Walking round the room singing stormy weather at 57 Mount Pleasant Street. Well, it's the same room, but everything's different. You can fight the sleep, but not the dream. Things ain't cooking in my kitchen. Strange affliction wash over me. Julius Caesar.
Well, I think Argyll and Bute is a good example of a rural placement, and one of the most important things you get here is the variety of the things that you see. If you're working in a big hospital and you're doing medical on call, for instance, you find that all heart attacks go to the cardiologists, all strokes go to stroke people, anything vaguely neurological goes to neurologists, and you're left with really very little to actually see and learn from. Whereas here, although we don't have a huge volume of patients, you get to see absolutely everything. You have no idea what's going to come in through the door, and you will be in the position of assessing that patient yourself and trying to find out what's wrong with them and what's the best thing to do with them. Coupled with that, you're not so busy that you can't actually learn from these patients. So it's not like you have to see 20, 30 admissions in a day and hardly can't remember the first one by the time you get to the end of the day. You'll be able to see all of these people as individuals, you'll get a good feel for what they're actually talking to you about, what their symptoms are, and you learn so much more from that. We like to think we strike the right balance between you actually evaluating the patient yourself and coming to conclusions about what to do with them, but having the support and supervision from a senior doctor. And that senior doctor is going to be a consultant, it's not going to be a registrar who's maybe just a year older than you are. So you're getting the benefit of that experience, but you're also getting to think about what to do. So we notice that most juniors come on really quickly here. We can see a huge difference in just a couple of months between, for instance, their first and their second night shift, because they're having to think, they just learn much more quickly what to do and feel more confident with what their level is. It's not that we want people to do everything on their own, because we are always here.
What I think is a great place to work is we do a lot of general medicine, general surgery here, even extremely general. In surgery you will be exposed to, well, even obstetric, a lot of trauma covering A&E, a bit of urology, vascular, surely, you know, upper and lower. If you become a surgeon and you made that decision already, you get the possibility to get into theatre more than in other places, because you know, we are always willing to have assistants here. We don't have a registrar, so you know, we rely on juniors to help us, and he's a direct, you know, teaching with the consultant. So for somebody who has decided to become a surgeon or is thinking of it, there is a possibility to do some minor surgery and other things. But
I think besides being a very busy hospital for basic medical specialties, the interesting thing about Oban is that it does collect a lot of challenging people on the psychiatry side, and during your stints in accident and emergency you're going to come across many opportunities for social situation assessments, suicidal assessments. You're going to learn a great deal in a short space of time about the way people present in different settings, and that psychiatry experience is going to be very valuable whichever branch of medicine you end up finding yourself in.
I think I've learned lots from working here. We get quite a lot of responsibility when we see patients. Although we're well supported by the consultants, I find that I've had the opportunity to make a lot of my own decisions and to decide on diagnoses and management and investigations. And additionally things like practical procedures, because there's nobody between either FI2 and GPST1 and the consultant. Normally if there's anything interesting happening, we have the opportunity to do it supervised. And it's really good for learning.
This is an ideal place to basically connect with the outdoors and recharge your batteries when you're not doing medicine.
Well, I think Oban's a lovely town. It's very picturesque, very quaint little place, and it's very friendly. All the locals are very nice. There's a lot of nice restaurants, and it's great access to the Highlands. You can get anywhere really within the Highlands within a couple of hours drive, and we've got fantastic port with all the ferries to the different islands around and about the place. It's a wonderful place for exploring.
I so far have enjoyed living in Oban. I think particularly if you like the outdoors, there's lots of things to do around the area. It's a really beautiful part of Scotland, and there's lots of interesting things to do. I enjoy hill walking and climbing, and there's plenty of opportunity to do that around here. I think it's a good place to live.
I like living in Oban because I get to do this on my days off.
I came here on holiday when I lived in Italy, and I love the sense. It's a very good place if you like the countryside. You know, of course, we don't have much in terms of you know, sort of the cinema is just reopened, but the countryside is fantastic. And if you are anything into sailing and kayaking or walking and climbing or cycling, is a paradise.